Maybe you're thinking of going to therapy, or you're already going to therapy, but you're still so confused about it. Who are all of these professionals in the mental health industry, and what do they do? How do I know who I'm supposed to see or who would be a good fit for me and what I'm dealing with? Trust me, if you're confused about the mental health industry and what's the difference between a psychiatrist, a psychologist, a social worker, a counselor, a psychotherapist, you're not alone. There are a lot of us in this industry and we have very specific training, but it's not always clear to the people that want to seek therapy about who the right fit is for them. In today's video, I'm going to be talking about the Canadian mental health system and the different professions and what we all do in the mental health industry, so you'll have a better idea of who you might want to work with and who might be a good fit to help you with what you're hoping to work on. I'm Meredith McKenzie of Parallel Wellness, where I'm a registered clinical counselor in British Columbia. I'm also a doctoral student to become a psychologist, one day down the line. On this channel, we explore topics that bring clients to our therapy practice every day. You'll find tips and strategies that you can make your own to enhance your everyday life and manage your mental wellness. So subscribe to the channel and hit the bell in the corner so you're notified when we post new videos. We publish every Wednesday. Now, before I get started, I want to mention some things that might actually make this whole topic a little more confusing. But that is, even though I'm going to be talking about a bunch of different professionals that have come from different training backgrounds and they now go by different titles in their profession, but it all really comes down to the individual. Some individuals practice very similar to other professionals, even though they have different training backgrounds or they have different titles that they go by in their everyday profession. So that's something to look out for. And I'll talk a little bit about that as well as I get into each individual profession, but it's not uncommon for people to say, well, I see a psychiatrist and he does therapy with me. How is that any different than the psychologist that I see for therapy? And while there's differences in their training that they received while they were in university, you know, a career for somebody is quite long, and so people, as they go along, they may be picking up different skills and different things that they feel really fits with their practice. So it's not uncommon that even though people have a very similar title or they're registered with a similar body, even if they're trained in a similar area, that they can work differently and they can work similarly to others in different professions. Now, I wrote a blog post on this quite a while ago, but if you're interested in reading it, I'm going to put the link in the description box down below so you can have a look at it. And again, just for reference, I'm talking about Canadian mental health professionals, more specifically in British Columbia, because that's where I am trained and where I practice at Parallel Wellness. So those are my experiences. I've seen other videos out there that seem to have more of an American focus. So some of the titles are going to be different. Some of the professions and what we're capable of doing or what we're permitted to do within our profession are going to be different. So just keep that in mind as you're watching. The second thing that can make it kind of confusing as well is that the terms counselor and therapist are not regulated in Canada. So what that means is anybody from a camp counselor to a therapeutic counselor can call themselves a counselor. And that can be really confusing, especially when we're looking online to work with different people. So it's really important for you to do your research, and you're actually doing that by watching this video, but it's really important to do your research so that you know what professional you're seeing, what their education level is, and what their training is, so that you know if you're finding somebody that's a good fit for you, and so that you can be confident that they're going to have the knowledge and the education to be able to support you with what you're coming to them for. The first mental health profession that I'm going to talk about is counselor, and that's one that's near and dear to my heart as I am a registered clinical counselor in British Columbia. Now again, it's going to get confusing, but registered clinical counselors in British Columbia can be both Masters of Arts in Counseling Psychology, they can be Masters in Counseling Psychology, which doesn't sound very different, but it does mean something different in terms of education. They can even be social workers. So it can be really confusing because there's a lot of professionals that can register in British Columbia as a registered clinical counselor. But essentially what a registered clinical counselor or a counselor is somebody who has an undergraduate degree that took them 4 years to complete. And a lot of people within our profession tend to do their undergraduate degrees in psychology. However, there can be other degrees that people pursue at that point. But at some point they've made the decision that therapy and becoming a counselor is something that they really want to do. After that, they complete a 2-year master's degree. And again, like I said, the master's degree can look really different. It can be a Master of Arts where you're required to complete complete a thesis in order to finish your degree, but there's also a Master's of Counseling Psychology in British Columbia, as well as Masters of Education, where you're not required to complete a thesis at the end of your program. The training though in therapy is very similar. So individuals with this level of training, or people that identify themselves as counselors, typically have training in therapeutic approaches, the best practices for working with clients with an array of different types of mental health presentations, and they also tend to work with people that are more so dealing with the day-to-day struggles of life, whether that be transitions, things within their marriage, parenting issues, as well as anxiety and depression, because anxiety and depression unfortunately impact a lot of people, but they tend to work with people more on a community basis. So what that means is people that are able to live in their home community without having to live in hospital or in a residential setting, and they can come to a therapy office to receive counseling sessions. Counselors can be found working in a wide variety of areas. Some people work in private practice, some people work for the community agencies like Vancouver Coastal Health, or they might be working for Fraser Health or Child and Youth Mental Health. Those are more the institutions within the lower mainland of British Columbia that offer services to individuals who are seeking out therapy. More traditionally, counselors have taken a shift away from the traditional medical model, where there's a hierarchy of individuals and these professionals are seen as the experts, whereas in the counseling field, there's a shift towards the client being the expert in their own life, and that the counselor's role is to be there to support them in, figuring things out for themselves in a way that would be best for them. And I would say that that's more of kind of the philosophy of counseling as opposed to other professions. Again, like I said though, every individual is different, and that doesn't mean that somebody coming into the counseling profession might not have a more, traditional viewpoint. So that's again something for you to talk with a potential counselor about before you start working with them, because finding a good philosophy that fits with what you're looking for and what they bring to the sessions is really important. Now, as I said before, the term counselor or therapist is not a regulated term, and that also goes along with the profession of counseling in BC, whereas in other provinces across Canada, they've now begun regulating counselors. In BC right now, we have the British Columbia Association of Clinical Counsellors, and we also have the Canadian Counselling and Psychotherapy Association, which is a nationwide body. The differences between British Columbia and other provinces is that counselors are not regulated. So these two bodies that I'm talking about, they're more of an association. They are a membership that we join as professionals, and yes, there are ethical guidelines, and there is a board of members who are kind of checking out and making sure that things are going well within the profession, and you're able to make complaints to these people. However, unfortunately, because we're not regulated, there actually aren't the same levels of protections for clients as there would be if we were a regulated body. That's something that we're working towards right now, and there's a lot of work within the government happening at this time to allow counselors to be a regulated body. This is kind of my side note, but another reason why I wanted to make this video is because counselors and therapists as terms are not protected. That means that anybody can essentially, put a sign on their door, make a website, and say that they are a counselor. There are programs, even in British Columbia, where somebody can go for training without an undergraduate degree and to receive a diploma in counseling. I have to be honest, I don't personally know about what that training looks like, but I am, I think it's fair to say that I'm going to be biased and I'm going to be protective of my own education. It took me a lot of time and work to get to where I am, and because of that, I do think that there's a lot of time and energy and just dedication that is required of this profession, that I think it would be really difficult for me not to have completed the amount of education that I have in order to see clients and to be effective in my work. Saying that, I would say if you're looking for a counselor, my best choice would be somebody who is registered as a registered clinical counselor or is registered with the CCPA, just so that you know that you're getting a quality therapist at that master's level. Next on the list, and this is still at the master's level, but this is a different type of master's degree, and that's in school psychology. And these individuals actually are regulated by the BC Psychological Association, and with that, they're able to get the title of school psychologist. Now, that doesn't mean that they've completed a doctorate degree, but at the master's level, they're able to call themselves a school psychologist. These individuals have very different training than the typical counselor with their master's degree, whereas the master's degree in counseling is focusing more on therapeutic interventions, people with a school psychology degree are focusing more on assessment, child development, and really understanding the ins and outs of how the brain works and how we learn, how we function in school settings. So really they're experts in this area of how people, how individuals, how classrooms work, so children and older learners can be successful in the school setting. If you're in the position where you're seeking out a school psychologist, you may be doing so because you're looking for an assessment. School psychologists typically do something called a psychoeducational report, and with that they're using various measures to get a really good sense of what somebody's strengths and what their areas of challenge are, so they can make up a really good comprehensive plan of how that person can be more successful academically. From here, recommendations can be made to improve the student's chances of performing at their best. You may come across these individuals in an elementary or secondary school setting. There's also lots of school psychologists that work in private practice. So we've talked about school psychologists, and now we're going to talk about psychologists more in general. This is another category that's going to be really confusing, so I'm going to try to make it make some sense. What differentiates psychologists from counselors is a doctoral degree. Now, doctoral degrees can look very different in Canada, more so in the States, I would say, but in Canada they can look very different as well. Now, here's the confusing part. A doctoral degree and the requirements for getting into a doctoral program in university can look very different. In any doctoral degree, there's a split between interventions or working directly with clients, research and completing a thesis or dissertation, as well as coursework that kind of is the foundation that informs the practice that you're going to do later on. So another confusing part here is that every doctoral program looks a little bit different with how they manage that ratio and how much time that each person spends in coursework, research, and intervention. There's also the difference between programs that require students to finish a master's degree before moving forward onto their doctoral studies, and doctoral programs that just start right at the bachelor's level and you progress through the entire doctoral program without completing a master's degree first. Okay, if that wasn't confusing enough, now I'm going to break down doctoral programs into the three categories that are most common in Canada. The first one I'm going to talk about is the clinical psychology doctoral programs. These programs are typically for people that are seeking to work out in professions that are more clinical in nature, hence the name. So that would include a hospital setting or maybe a treatment program that has a higher, more intense level of treatment that the clients are receiving. Clinical psychology PhD programs have also more traditionally been focused on the research side of their program. So that might mean that in terms of that ratio, that the research portion of their training is a little bit bigger than the other two areas of the program. The second psychologist stream that I'm going to talk about is the PhD in clinical psychology, which is the program that I'm in. Now, the counseling psychology PhD stream is very similar to a clinical psychology PhD stream in that you're expected to usually complete a master's before you go on to the doctoral studies. However, what makes these programs a little bit different is that there tends to be a little more focus on practical intervention work with clients, and as well, like I was talking about with counselors, the focus tends to be more on working with clients in a community-based setting. So maybe they're coming to an office, but they're living in their own home setting, and then they're coming to you. So when we think about the different stages, that would be kind of like a secondary care, whereas being in the hospital would be at tertiary care. Counselors or counseling psychologists tend to see people more in the community. Again, I'm going to clarify this later, but that's not always the case, but this is just kind of the traditional stream or how things may look if you were going in a more traditional way. Now, the third stream to become a psychologist that I'm going to talk about is the PsyD program. Now, the PsyD program is different and it's newer to Canada. We have a program in Newfoundland and we also now have a program in British Columbia, but they're not as common in Canada yet. Whereas in the United States, PsyD programs are quite common. This is very new to us, and so I think our system is trying to figure itself out a little bit, but there's a lot of benefit to these professions as well. So the PsyD program, like I was saying before, not all programs require you to do a master's first. When someone completes a PsyD program, it's not necessary for them to have completed a master's before they go into their doctoral studies. PsyD programs tend to be longer though, so they're typically 5 years, whereas my program is 4 years, and that's to make up for that time because you're maybe getting somebody who's new to the profession and they're starting from the bottom where somebody else who's completed a master's already has already done in those previous 2 years. PsyD programs also more traditionally focus on the practical side rather than the research side of things. So yes, the people in PsyD programs complete a dissertation, but that might not be the main focus of their work, or there might not be the same pressure to really focus on research as there is in other programs, because they're really trying to hone practice and to make people into very good practical clinicians. So you might see how some of these programs might attract different types of people or might attract people that want to work in a specific area, but that's not always the case, and so I just wanted to clarify that as well. When you're thinking about different psychologists and the potential of seeing a psychologist, just know that each person has a doctoral degree, and that's kind of the thing that stands out, that they do have extended education that does enhance their knowledge and what they're bringing to therapy sessions. The other thing that sets psychologists apart from counselors, because they have those additional years of training, their programs focus more on comprehensive assessment and diagnostic information. So if you're looking for a diagnosis, going to a psychologist would be the person that you would need to see in order to receive that diagnosis, where you can't receive that from a counselor. I'll talk about other professions that can also give you diagnoses, but this is where, counselor goes to becoming a psychologist, and they're able to kind of do more within their practice. To be honest, that was a big part of why I chose to continue on with my education. I wanted to learn more. If you know anything about me, all I want to do is learn. There's never enough learning for me to do. I felt like there was something more for me to take on in my profession, and that was really exciting for me. So the next profession I'm going to talk about is psychiatrists. And I think a lot of people can get confused about what does a psychiatrist do. Now, a psychiatrist has an undergraduate degree that takes them 4 years to complete, and then they go on to medical school, which is different from any of these professions. So psychiatrists go to school for an additional 4 years to complete their medical degree, and then from there, in their residencies, they end up starting to specialize in whatever it is. So, some people go on to do cardiology, and then psychiatrists go on to do mental health work. So as opposed to your regular general practitioner that works in, say, a walk-in clinic or your doctor's office with your family doctor, a psychiatrist possesses specialized knowledge on psychotropic medications. So if someone's, say, dealing with depression, anxiety, schizophrenia, any kind of mental health concern that may require medication, a psychiatrist is who you see. Again, if we were following the traditional medical model of treatment, a psychiatrist typically works in a hospital setting. They're a medical doctor. However, in the community, there's lots of psychiatrists that work for different teams, providing medical information and support, prescribing medications to different clients. They also work in private practice. And this is one where I'd like to point out that psychiatrists can differ in how they approach working with clients, whereas some really stick to, prescribing medications and monitoring their clients while they're on their medications. Some psychiatrists do provide talk therapy, and that's more similar to what you might find in a psychologist's office, but there's lots of psychiatrists that also do talk therapy. So it's hard for us to really say which profession is which and which is the best one for me, because you might find an excellent psychiatrist that provides talk therapy to you. To touch a little bit on the cost of seeing these individuals as well, a psychiatrist is typically covered by MSP or the medical services that are provided by the government, whereas a psychologist is not covered unless you're working in a specialized program where you're receiving that already because it's government funded. If you're seeing a psychologist in private practice, you'd be paying out of pocket or through your extended health benefits. The same would be said for a counselor. However, there's quite a few benefits programs that only cover psychologists or social workers, and they won't cover a counselor. If you're interested in working with a psychiatrist, it's very tricky to get in to see one because their availability is quite limited. Typically, you require a referral from your doctor, so start there first, unless you're already enrolled in a program where they have a psychiatrist on their team, and then they can do some internal referrals for you. But starting with your GP, because it's like getting any kind of specialist referral, you need to get a referral to see a psychiatrist. And the last mental health profession that I'm going to talk about today is the social worker. So social workers, again, they go back to that traditional medical model. In the past, social workers worked in hospitals, and they've also traditionally worked in family preservation and adoption and child protection. And so in BC, those might be the places that you're familiar with working with a social worker. Their training is very different. They do get a little bit of therapeutic training, but they're also trained a lot in ethics and the laws and a lot about the hierarchies and all of the different social injustices that happen in our world. And so they have a very specific type of training. There are, however, lots of social workers who choose to go into a more therapeutic route where they get additional training in therapy and intervention and working with clients in that way. So if you're thinking about working with a social worker, because again, going back to funding, there are some benefits packages that prefer to fund working with a social worker, that could be a great option for you. There's also, like I said at the beginning of the video, lots of social workers that register with the BC Association of Clinical Counselors, so then they would call themselves also registered clinical counselors, even though they're social workers. So if you're interested in working with a social worker, I'm going to provide links down below for the different bodies that register these different types of professions, and you can, have a look to see what would be the best fit for you, because most of these websites also have a search option where you're able to go and look for professionals and who you think would be a good fit for you. So those are all the mental health professionals that you're most likely to come across in British Columbia, in Canada. I know some of the names across Canada are a little bit different, but these are the ones that we use in British Columbia, but they should be pretty similar if you're watching this anywhere else in the country. If you have any questions about this, because I honestly had a lot of questions myself as I was trying to think about what I wanted to pursue in my career, definitely send me a comment in the comment section down below. I'd be happy to chat with you about this. I think this video is probably just as helpful for potential clients and people that are seeking out therapy, as well as the people that are thinking about where they want to go in their career and what path they want to choose. So if that's something that you're interested in seeing a video on, leave the comment down below about that, because I'm really interested in doing an offshoot within this channel on becoming a therapist, becoming a counselor, becoming a psychologist, and what that process looks like, because I think it can be a really lonely experience, especially when there's so many demands on you. So if you're interested in videos like that, leave a comment. I'd love to talk to you about it and make videos. If you're interested in booking a session with one of our registered clinical counselors in Burnaby or North Vancouver, visit our website at parallelwellness.ca. There, our registered clinical counselors have their full biographies and you can book online. We also love to be social and be a source of positive, informative messages online. So check out our Facebook and Instagram at Parallel Wellness. And again, if you have any questions about mental health professionals and who you should possibly be seeing and who might be a good fit for you, leave us a comment and I'll see you in the next video.